The final example is a 48-year-old patient with microscopic polyangiitis, recent diagnosis 2 months ago, p-ANCA positive, active nephritis, renal dysfunction, creatinine's 210, active hematuria, and a history of cough with infiltrates for the preceding week. Start him on cyclophosphamide and steroids as you normally would, and a month later you reassess him for BVAS. There's no improvement in his cough. He's still coughing just as much, but actually his chest x-ray has improved. There's a reduction in the size of the infiltrates, and his creatinine has normalized. It's gone from 210 to 97, and his urine has improved. He's now got less red cells per high power field, but he's still got some. So it's gone from more than 25 to 14. So let's first look in the chest. We have an infiltrate to tick, and as you remember, he's had a cough with infiltrates, and therefore you should be ticking it within this time frame. That's correct. In the renal system, you tick the hematuria because he's had more than 10 red cells per high power field. That's correct. And do you tick the persistent disease only box on this occasion? That's correct as well. So this is an example of a patient you saw a month ago, you assessed all his BVAS items, there was active disease, you're seeing the patient again for follow-up, and at that time there is improvement in the active items. So things are not new worse, they are persistent, and they are persistent within the correct time frame, and there are no new worse items to supersede you ticking the persistent box. So you are allowed to tick the persistent box for this patient.